my name's John Coates. I've been involved in biofeedback for about 8 years now. I fell into it in a roundabout way, but it doesn't really matter. So what I'm doing now is testing the autonomic nervous system of patients of a rheumatologist. He sends them to see me, and I do this with a series of activities, a baseline, a stressor, a rest, another stressor, and a rest. Then I go through the screens with them, what we've found so far. Then I get them breathing at the resonant frequency of 6 breaths a minute. Now, 6 breaths a minute is a normal rate. It does vary in people, but because some of these people are pretty sick, they can't handle the testing routine to actually ascertain their rate, which would be, some would be between 7 and 4.5 breaths a minute. And then I report and I extract the information from Thought Technology ProComp Infinity and put that into a program called Cubios, which analyzes it and produces some fancy graphs and stats. And from that, I extract information to put into a report. And he then factors that into his treatment plan for his patients. What I'm looking for in what I do is to see if their autonomic nervous system dysregulates. That means it goes haywire and you get the SDRR, which Mind Mirror doesn't seem to do for some reason, but that goes absolutely crazy. You can get some very, very high readings. And the common consensus among the gurus is anything under 50 is considered poor health, 50 to 100 is compromised health, and above 100 good health. But because readings can rocket up to over 1,000, it doesn't mean they've suddenly got good health. It just means that the autonomic nervous system is not handling the stresses. Now, the stresses I use is the Stroop colour test. You may be familiar with that. If not, it's just coloured words, but you say the colour of the word, not the word. So yellow might be red, so you would say red, not yellow. And the amount of time each thing's on a screen decreases. I've set it up so it decreases down to 4 seconds. That's followed by the rest period. Then I get them to talk about their health issues, which can throw them into complete disarray. And then there's a rest period. And then, as I mentioned, I then go through the screens with them and hopefully explain it to them that things are good, not so good. Some people hang on to their stress, they don't let it go in the subsequent rest periods. Others do. And I mainly look at the SDRR. And the PN50, it's not a good indicator, not for this anyway. And I look at the RMSSD, but that's mainly an indication of what the high frequency or parasympathetic nervous system's up to. I noticed in the Mind Mirror he mentions that rather than the SDRR. Generally considered an indicator of overall self-regulation and resilience. So in other words, are the people handling the stress thrown at them or are they not? You would expect it to go down under stress, but as I mentioned, it goes up in some people, which just indicates that the nervous system is not handling the stresses because of how sick. And some people, are really sick, I see. If you really want to get into heart rate variability, you really need, to be able to measure the breathing to see what's happening in tandem with the heart rate.
How do you measure this breath, or what do you see?
Well, it's a little Velcro belt that goes around the middle. It's got a rubber tube that expands and contracts, and the sensors are attached to that. I think way back I mentioned it to Steve, and he said he could possibly be looking at it down the track. So that would give you a pretty full-on indicator of heart rate variability and being able to train people. Because heart rate variability to ascertain it and then train people to increase it. That's the sort of pure HRV.
So I did 2 tests, as you noticed. One test was just my experiment with breathing. I was breathing normally, then trying to breathe fast like a dog. And then I was taking long pauses in between my in-breaths. And then I kind of almost stopped breathing. I was holding my breath till the end. And so that's what you can see on the first graph, which shows basically, it says BVP pulse rate. This is what you see on the screen when you're recording Mind Mirror session. And then I recorded myself again doing 6 breaths per minute exercise with the application that you advised me to use. I found it in Google Play and downloaded it. So it's called My Calm Breath. And you can see it's completely different story. Now we have very nice peaks and very organized breath. Maybe you would like to comment and say a few words, you know, why this 6 breaths per minute is so good. And
well, this is considered the resonant frequency where you get the balance in both ends of the autonomic nervous system. As I mentioned, it does vary in people between 4.5 and 7 breaths a minute. But a good nominal rate, which was used for many years, is 6 breaths a minute, and you will get some gains in heart rate variability. So it's like fine-tuning your car, finding this actual resonant frequency for each person, somewhere between 4.5 and 7. But you can actually buy a thing called you can buy My Calm Beat, with a little thing that clips that goes on your ear, and you can actually ascertain it if you want to. And it takes you through a series of breathings down from 7 down to 4.5. Now, you've got an Android phone. You said Google Play, didn't you?
Yeah. I've got a tablet. It shows nicely how your lungs fill up and.
Yeah, it's quite clever. Do us a favour and check the time in and the time out, because I've tried to use that on my Android phone, and it seems that you breathe in longer than you breathe out, and it should be the other way around. I have spoken to them about it years ago, but they don't appear to have anything to do with it. And there's a thing called paced breathing that's better on an Android. You can set it up, time in and out yourself, and put a pause in it.
I think we could do it even in Mind Mirror, apparently. But you also mentioned today that I shouldn't over-exercise doing this 6 breaths per minute.
Originally, the gurus indicated twice a day for 20 minutes at a time. And I've tried it, and it's pretty full on. And the reason I stopped doing it was on the advice of the referring doctor that his patients could not do it. And he's right. Some people can't even handle 5 minutes, which is the period I try and get them to breathe at when I'm running through the session with them. So if you can get 3 minutes 2 or 3 times a day, 4 times a day, that's pretty good. Yeah, the heart rate variability increases over time. It's not an overnight thing. Can take 1 or 2 months. But you can actually see the improvement in most people when they're just doing it for the first 5 minutes. But it needs to be done on a regular basis. It's like flicking a pendulum. Unless you keep flicking it, it's going to grind to a halt. What you're actually doing, you're helping balance out the autonomic nervous system, but you're increasing what is known as the Baroreflex Gain, which when you breathe in, your heart rate goes up. When you breathe out, it goes down, providing you breathe out longer than you breathe in. So 40-60 on that breathing pace is a good ratio, but the baroreceptors actually react to blood pressure changes. There's stretch receptors in the major arteries. So if your blood pressure rocks, they slow the heart down, and the reverse is if your blood pressure drops, they increases the heart. This is happening all the time. So what the breathing does is actually increase this difference between breathing in and breathing out. And this is where the health benefits come in. The bottom one is okay. On the extreme end, I'm not sure. Each end is something happened, whether it's just you settling down into it, and then there's a big drop.
I think I moved. It could be probably movement artifact.
Yeah, that's the danger. I don't know if you can take them out to do your report in the Mind Mirror or not. Because in what I use, you can. And if necessary, I'll go into the IBI millisecond times and have a play with that. But that's a typical thing you should see when you're breathing at a slower rate. And the top one is just breathing normally. It can be all over the place because we don't look at our breathing during the day unless we sit down and consciously focus on it. We just breathe and just breathe the way we're doing.
So the numbers below are the numbers generated by your software. So the first 103.5 is heart rate.
Yeah, that's close enough.
So when we talk about heart rate, 100.3.5 or anything over 100, does it mean anything, or how do I interpret that?
It means it's pretty high. One would expect your heart rate to increase if there's stress, and the fact you're breathing in not a normal way would indicate some sort of stress on your sympathetic nervous system.
The next one, 82.7, is
the RMSSD. That's a mean square of the standard deviation of successive difference in neighbouring RR intervals, and it's an indication of the parasympathetic nervous system activity. And I find that rockets up in some people when they start to dysregulate.
it's 82.7. What does that mean?
Exactly. Now, you were a bit towards the end when they get a few very high interbeat interval increases, and it can cause that to go up.
Mm-hmm.
So it's not that simple, unfortunately. It represents electrical stability in the heart, and it's influenced by the parasympathetic nervous system.
So HRV index will be the index of heart rate variability that calculates the difference between the highest and the lowest heart rates during each respiratory cycle. So,
well, the software I've got doesn't look at that. You look at it on the screens when I'm testing people. The researchers just don't worry about that one for some reason. It's not a constant. It's just a quick rough and ready saying, yeah, well, you've improved or you haven't improved. But looking at the other side, when you're breathing, you have improved because it's gone up.
It does improve when you are calm, right? When you are breathing with a nice pace. And that's clear because it was 7.7 and it became 12.3.
Yeah. Now, I've seen people that are supremely fit, athletes and the like that really train and young and fit, that can be 20 or 30, even higher.
Wow.
And as we get older and or sick, it tends to reduce.
There's some other tricky indicator, PN50.
That's the percentage of interbeat intervals of the 50 or more of the adjacent one. So that's an indicator of heart rate variability too. So the bigger that number, the better too. Means you've got more variance between each interbeat interval.
The last one is stress index. And
yeah, well, I can assume that is the ratio between low frequency and high frequency. And the higher the number, the more stress there is, and the lower the number, the more, well, not stress, but the higher the number, the more the sympathetic nervous system is active, and the lower the number, the more the parasympathetic is active.
I think with Velistus, it should be as close to 1 as possible because that will indicate no stress. Stress index is a measure of the ratio between the parasympathetic and sympathetic tone. If I look through these plots here, the first one is clear. It basically shows what we see on the screen. The next one, R2R interval values. Yes, and then you see the graphs, and yes, it's absolutely clear here on this IBI distribution. But my second test was showing better this heart rate variability because the lines are taller. And here when you see HRV somewhere in point care distribution, it's the same.
But I prefer to just look at the stats because they
I remember once
more.
again you said look at in between interval, this BVP indicator here, standard deviation, and that will be the indicator to look at.
Yeah, I don't. That's the SDR. Yep, that's pretty good. You're approaching 100, which is good. And you can see the maximum was 1496. That means your heart went pretty slow and it sped up quite a bit too. These are the R to R intervals. And you can see moving around, it leapt up, and this distorts a whole heap of things. If you look at this number here, the SDNN, which is SDRR near enough, it's 80, which you would say on the face of it's pretty good. But when you sort of get rid of those jumps, it drops down to a lot lower. So this, I see all these sort of things, a lot more than that, which I have to call dysregulation for what I'm doing. It just, and this number just rockets up. So that's a fairly reasonable number for most people. But then you're still mucking around there. But the next one to look at would be your breathing at 6 breaths a minute. The other thing I look at is this. And these are the graphs in the frequency. So that's very low frequency, which represents in short-term recordings, worry, anxiety, rumination. This is the low frequency, which is what we need to balance when we're breathing slowly, and this is the high frequency or the parasympathetic. So that end, basically sympathetic, and that yellow, parasympathetic. And you see the LFHF frequency, I think is stress index, is 1.3 overall. And there's a Poincaré, which is, because that's probably okay. You've got a good distribution for heart rate variability, but when you drag that out and get everything in, all the funnies, then it sort of clusters down here. Can you see all this up and down, Bess? So that's dysregulation.
Yes.
When it's talking about our health. And if you look at this, it's pretty up and down, but I think the numbers are the best because this SDNN is 449 and the RMSSD is rocketed up too. This is, to me, is dysregulation. And even though the power's spread out, she's still, you know, you can take all that out with this software and come back to a more realistic number. Look at this 449, and I'll just do a very strong edit on it and apply it, and it's come down to probably what it would be without the dysregulation. It's a good indication if you've got all that. If I undo it, it goes back up again. This is one thing you've got to be a bit careful of with heart rate variability in my mind, that are you getting dysregulation or not? And you can, I guess, pick that up by ups and downs like this in the graph. And sometimes you have to look at the IBI for that, not the pulse rate.
The first part results you're showing, it was the talk about health problems.
Yeah, what I get people to do is talk about when their problems started, what was happening in their life, because I find that emotion involvement can throw the autonomic nervous system off quite a bit.
Yeah, so literally it's a great evidence for people to know how a negative judgment and emotional response affects their heart, and how literally, which means how stress affects your heart. And you, the previous time we talked, you mentioned that even negative thoughts can affect people's heart rate, heartbeat.
Yeah, you can see that was her baseline. She's, based on the figures, she was more sympathetic. So when she did the mass test, which is taken 7 away from 1,081, things went a bit haywire. Then when we had the rest period, she went basically parasympathetic, so her sympathetic nervous system kicked in. Talking about her issues, she was jigging around a bit, but also there's a lot of, you can see that there, went up to 843. And then when she left that alone, started resting again, we got a lot more parasympathetic activity going. As you can see here, you've got 75% of the power the heart was putting out was in the parasympathetic zone. So I guess in a way, autonomic nervous system was working okay. But then when she started breathing at 6 breaths a minute, then you can see that it increased dramatically where it should be. So you're looking for a peak there at about 0.1. But she still had power in the parasympathetic, which, because I would expect that number to rocket up 20, 30 or above, not sit at 1. She's still got too much parasympathetic activity there, because when you're breathing at this slower rate, all that goes away and all that goes away. You've just got everything focused in that low frequency. And that's where you get this massive increase in the LFHF ratio. It's an important part. You can see down here the percentages there. Well, I'd love to see that at 2.7 and that one up 890, whatever. Now, what I've done in the past, I'll probably mentioned before, is get people breathing. So they show this, get them to think about something that causes them emotional grief. It's really, that will tend to fly down there. This pink will rise up. Then get them breathing again to get that balance, and just bounce in and out a few times, and you can actually change their response to it. It doesn't change what's happened, but it's getting rid of all that negative energy from it.
Looks really good. It should teach people to start breathing as soon as they feel stress, and don't think
Yeah.
negative thoughts, and stay positive and stay healthy. And that way your heart will keep on working and serve you longer.
Yeah, well,
That's
too
what I
much
can
stress
see.
will give you heart attacks, there's no doubt about that. Very good question. I'm waiting for my sensor to come back from Steve. He's told me it's been posted. If I get the time, I'll start having a go at it and just see where I go with it. I've got one guy interested in coming to have a look, and he's in the corporate scene, and he's thinking about introducing me to them for the heart rate variability amongst the executives, that sort of thing. So maybe able to introduce the mind mirror in too. He's an NLP trainer, so he wants NLP and meditation and the like into the corporate sector, because let's face it, the stress among some of these guys must be tremendous. That's his plan.
Okay, John, thank you very much.
Okay, will do. Thank you.